What I am going to talk today is not something that is written in the books, or it's not something that is there in the syllabus of homeopathy, or it's not something that you'll be able to read anywhere. I mean, why should I talk about something that you can read? You're all intelligent to read and understand things. I'm basically going to talk about my experiences. It's been about 28 years and I've been treating, and I'm only going to talk about some of my experiences, some of my conclusions, my own experiments that I have been doing on patients, my theories. A lot of what I talk today may not be proven under the microscope or scientifically proven. I may not be able to prove it, but so is homeopathy, so is God. So it's just a theory. I'm trying to put in some thoughts in your mind so that we can think about it and we can go forward. Before I go on to telling you how the practice can be taken to the next level, I'd like to emphasize on the fact that there is a lot of power in being a doctor. By virtue of being a doctor, you're very powerful. The power that you yield is something that you yourself are not aware of. I want to prove to you the kind of power that you hold as a doctor. Something very important. So for me to explain to you how powerful you are as a doctor, I need to explain to you something about consciousness and subconsciousness. Now, as I'm talking to you, you're listening to me. This is a conscious talk. We are talking to each other. There is something called as a subconsciousness in each of us. The subconsciousness is a power, it's a memory bank. Now, the subconsciousness carries the memories of our entire life, basically from the womb to the tomb. Now, there is also a theory which goes that subconsciousness also carries memories from past lives. But we won't discuss this here unless somebody brings it up and all that. We will stick to the memory that the subconsciousness holds from the womb to the tomb. That's enough for us to continue with the talk. There was one Dr. Srinivas Chari, I think one senior doctor who is very active on the WhatsApp group. So he wrote that the doctor is the center of the universe. So the moment I read about it, I was like, okay, what is this man? How can he praise the doctor so much? He's the center of the universe. But as I began to look into it, I started realizing that what he's talking is the truth. Probably at the end of the lecture, you will also realize that doctor indeed is the center of the universe. So like I told you about consciousness and subconsciousness, as we begin our life from the childhood, all those things that happen in our life are registered in our subconsciousness. Now, as a child, till you mature, you are open to your subconscious mind. That means whatever anybody is telling us, it could be our parents, it could be our grandfather, our uncles, our teachers, the one who takes care of us, whatever they are telling us, that goes directly into our subconsciousness as a kid. It goes and registers in our subconsciousness. As we grow up, as we mature, as our intelligence begins to kick in, we start filtering it. That means we don't take in everything into our subconsciousness that we hear. We start to be selective as to what goes into the subconsciousness and what does not go into the subconsciousness. It's like a conversation after that. Then only few things go into our subconsciousness. So whatever happens in the childhood, be it something nice or be it something traumatic, like somebody is dying, somebody is close to you is dying, it could be a childhood trauma of sexual exploitation, it could be a major fight that is happening in the house. It leaves a scar in the subconsciousness. These scar or these vacuums are what goes on to lead to a physical anomaly as you grow up. These are the scars which remain in the subconsciousness. I'll give you a few examples of this. As a child, a lot of us tell our kids, don't get wet in the rain, you'll fall sick, you'll get fever. Now, I don't see much of a difference between getting wet in the rain and getting wet in the shower. But when the child gets wet in the rain, it comes back home, sleeps, and the subconsciousness talks to it, says, that your father said that when you get wet in the rain, you'll get fever, and the child invariably gets up in the morning with fever. Don't eat ice cream, you'll get throat pain. It's not the ice cream that's causing the throat pain, but it is the subconsciousness that is talking to the mind, the body, that causes the throat pain. I'm telling you that the body listens to the subconscious mind. You will ask me how. Now suppose a child is running, it falls down, it hurts the knee. The mother takes the child, puts the child in the lap, rubs the knee and tells the child, you're going to be okay, don't cry, your pain is going to go away. The pain goes away, right? That's because the subconsciousness is directly active to the mother's words. So what the mother says works. That means the child's pain goes away because the body listens to the subconsciousness. Now there are many examples which I can give you. Let's talk about a lady who is going for a ultrasound. Now the radiologist, a random radiologist, she doesn't even know. She's doing an ultrasound, and as she's doing an ultrasound, she makes a statement saying that, oh, you got PCOD, you will have difficulty in conceiving. It's a random statement. Probably the doctor didn't even mean it, but that registers in the patient's mind. You have PCOD, you may not be able to conceive. Now, that's something that registers, and believe me, that patient will find it very, very difficult to have a baby. There are ways of clearing that particular subconscious command. It has to be cleared by some other doctor whom this lady trusts much more than this particular pediatrician or the radiologist, and they have to override that particular statement. That is when the lady can get pregnant. So whatever is there in the subconsciousness can be overwritten. There are different ways of overwriting it. Now, a random doctor like a radiologist, if she's got the power to alter the state of that particular patient, one statement from her and she can't conceive, just imagine the power that you have over the patients. Now the patients are coming to you who have been sent by somebody, who have been referred by somebody. They come to you already with a lot of faith. When they come to you and when they talk, they come to you with a very open heart, very open mind. Their subconsciousness is open to you. There are a lot of other people in this society who can influence the subconsciousness. So apart from doctors, there are also other people in the society who can access your subconscious mind. So they are the priests in temples. You know, we grow up listening to the priest in temples or churches or in mosques, the law enforcement authorities, politicians. So from childhood we grow up listening to them about God. We are taught the moral science, okay, you need to be good, you can't steal, you need to pray to God, and even when we grow up, these things are there in our system. We believe these things, we follow these things because they've been told to us in the childhood and these have been embedded in our subconsciousness. So as we grow up also, they never go away, they are always there. But although there are other people who can influence like politicians and priests, we always have an iota of doubt about their genuinity. In fact, we sometimes doubt God itself. So, it's not a very open relationship with them. But when it comes to a doctor, there is nothing to doubt about the doctor. There cannot be another motive for the doctor to tell you what he's telling you. So whatever the doctor is telling the patient is taken as a command from God. It is so important what you speak to the patient because the patient takes it in the literal sense, number one. Number two, it goes into the subconsciousness directly. It is not going into the conscious level, it is going to the subconscious level. So this particular patient who was being told that she cannot have a baby because she's got a PCOD, she comes to me. How would I handle that patient? She comes and tells me that I've gone to an ultrasound and the doctor said that I cannot have a baby because I've got PCOD. So you not only just override the command, but you also need to justify what you're talking to. You can't just randomly give a statement. So the way I would handle it, let me explain to you. I would say, listen, PCOD is a very common problem. There are a lot of young girls who got PCOD. Almost about 60% of the girls, 70% of the girls have got PCOD today. Do you mean to tell me that this 60 to 70% of the ladies will not conceive? Is it possible? What am I doing here talking to her? I am giving her a logic. I am explaining to her that it is not possible that you will not have a baby because you got PCOD. I am explaining to her with logic, and then I am going to tell her, you will have a baby. There are millions of people who have got PCOD but they can still conceive. I am giving her the hope. I am telling her subconscious mind, do not worry, you will definitely conceive. So what I have done here is I have overwritten the statement that was given by the radiologist. This is how powerful you are as a doctor. Every statement that we make to the patient is very powerful. Now, let me just talk about hereditary disorders. Now, like I told you right in the beginning, most of what I am saying is a theory. I am giving it out to you. I want you people to think about it, whether it makes logic, whether it makes sense. Now, we talk about hereditary disorders. It is written all over that hereditary diseases like BP, sugar, autoimmune, psoriasis. These are diseases which are genetically transferred. But I'd like to give a different theory here. I'm saying that if a child is born with a genetic condition, in the first couple of years of their life, I am calling it as hereditary disorder or congenital disorders. I am disputing the fact that a patient who gets BP or diabetes, when he reaches the age of 25, I am saying that's not hereditary. Now you will ask me why. Why is it not hereditary? The theory goes around saying that, okay, if you have a tendency for diabetes as you grow up, when the congenial atmosphere comes, you eat a lot of sugar, you have a lot of stress. I mean, isn't this the same excuse that we give to everybody? We don't know anything about it, we say it's because of stress or because of allergy. That's what the doctors are, that's our escape route. I'm saying, let's think differently. Now we are talking about hereditary diseases coming after 20. Now what happens? Suppose you are born to a family of diabetics. After you are born, as you are growing up, you are hearing people around you talk to you. Don't eat sugar. You're going to get diabetes because it runs in the family. Don't eat too much of salt. You'll get BP because it runs in the family. Be careful, man. Don't be complicated because depression runs in the family. So what is happening? Like I told you, from the childhood, the child's mind is open. It is going directly into the consciousness, whatever you're talking as a child. What is the child growing up listening to? That as I grow up, I will get BP, as I grow up, I will get diabetes, as I grow up, I will become schizophrenic or I will get autoimmune disorders. This is a subconscious command that is constantly there in the, I've got cancer in the family, as I grow up, I will get cancer. So you are going on about it. Subconsciously, every time you eat a sweet, man, I've got diabetes in the family, but it's okay, just one time. But every time you eat it, you're subconsciously telling yourself, your body. Remember what I told you, your body always listens to your subconsciousness. Let me give you a very small example of people who are fat. Now, obesity runs in the family. Now, this kid is born, as he's growing up, he's being told, don't you overeat, your father is fat, your mother is fat, your grandfather is fat, don't eat, you will put on weight. So this guy, every time he sits on the dining table, every time he eats a sweet, every time he eats anything, subconsciously he is telling his body, I'll put on weight, I'll put on weight, I'll put on weight. Whether he eats or not, poor fellow ends up becoming a fat fellow. I'm saying I'm not calling it as genetic, I'm calling it as the body listening to the subconscious mind. What happens opposite in a lean guy? He's got lean people in the family. This guy is very confident about him, whatever happens, I will not become lean. So his subconsciousness is telling him, you eat. He is not bothered when he is eating. He is not telling himself, I am eating this, I am going to get fat. How much ever he eats, he is not going to become fat. So what is the body doing? The body is listening to the commands that the subconsciousness is giving. Now, I am telling you this, that body is listening, but how do you know that the body is listening? I mean, we are all doctors. We need some proof that the body listens to the subconscious mind, right? You can't just listen to what I am saying, although all of whatever Venu said. You won't take what I am saying for the sake of it. You need proof for what it is taking. So let's do a small example. I want all of you to just listen to me very carefully, okay? I want all of you to close your eyes, put your hands on your thighs. All of you, close your eyes, put your hands on your thighs facing upwards. And take a deep breath. And exhale. Listen to me, be with me. Inhale and exhale. Every time you inhale, you're taking in a lot of energy. Every time you exhale, you're giving out all the negativity in the body. Every time you inhale, you take in energy. As you exhale, your body is relaxing. Let your body relax completely. Completely relax. You can hear my voice. Just listen to what I am saying and imagine what I am telling you to do. I want you to imagine that you are in your own house now. Walk to the kitchen in your house. See yourself walking into your kitchen. See the fridge. Open the fridge. You'll find one lime which is kept in the fridge. Take that lime out, the yellowish greenish lime. Go to the wash basin. Wash it. Take a knife. Cut the lime into two. As you're cutting, you can feel the juice flowing out of it. Separate it into two pieces. Squeeze the lime. Put it on your tongue. Alright, now you can all slowly open your eyes. What I've done now, all the while before this, I was talking to your consciousness. Now what I've done is I have spoken to your subconsciousness. Was there a lime in this room? No. But most of you would have got salivation, right? So what is happening now? Your body is listening to your subconsciousness. Correct? If your body is listening to your subconsciousness and the brain is releasing saliva, all that is necessary for your brain to work or react is a command. But the command has to go into the subconsciousness. Once the command goes into the subconsciousness, the body will listen to the subconscious command. So I've told you about subconsciousness. I've told you about how the body listens to the subconsciousness. I've kind of given you a demonstration about how the body listens to the subconsciousness also. Now, coming to the brain. We are talking about, there is a statement which I'd like to read out, which is there in most of the textbooks which are written out. The brain is the most complex organ in the body. There are 100 billion nerves that are constantly communicating with one another, controlling what we do, what we think, and what we feel. When the brain and all of its parts are functioning optimally, all is well. However, sometimes one piece of the puzzle falls out of place, creating problems for mental or physical health. Now, this is a description of the brain. Does it sound familiar? Does it sound familiar like our vital force? Isn't it something similar? That's what I gave is the explanation about the brain. Okay? Let me go a little more deeper into the brain and the neurotransmitters that are there in the brain. I'm not sure how many of you are aware of the neurotransmitters. Most of the students who are freshly passed out, I'm sure they would know. I also didn't know much. We had to do a lot of Googling. But there are a lot of neurotransmitters that are released by the brain, like dopamine, oxytocin. There are quite a few serotonin which are released due to a particular stimuli. Like for instance, serotonin I think is released by giving a hug. Dopamine is released by flight. There are a lot of things which release these neurotransmitters. And according to the definition that is given here, as long as the neurotransmitters are produced properly by the brain, we are in a complete state of well-being. The moment the neurotransmitters stop producing or are reduced, we go into mental or physical health. Now, neurotransmitters are again not directly produced, they are indirectly produced. The source of neurotransmitters can be there in the food. It is all around the nature, it is there. Some food also stimulates the neurotransmitter, like a hug stimulates neurotransmitters and all that. Now that I have explained to you about the brain, I want to compare the brain and the vital force. Once again I am telling you, disclaimer, what I am saying is a theory. I am not basing it on scientific facts and data. It's a theory. I want to put a thought in your brain basically. Before that, I'd like to read this aphorism 9, which is there. In the healthy condition of a man, the spiritual vital force, the dynamics that animates the material body, rules with unbounded sway and retains all the parts of the organism in admirable, harmonious, vital operation as regards both sensation and functions, so that our indwelling, reason gifted mind can freely employ this living, healthy instrument for the higher purpose of our existence. Similarly, aphorism 10 says, the material organism without the vital force is capable of no sensation, no function, no self preservation. Isn't he talking about the brain? Without the brain, there is no sensation. Without the brain, there is no function, there is no self preservation. It derives all the sensation and performs all the functions of the life solely by means of the immaterial being, the vital force which animates the material organism in health and in disease. So, aphorism clearly says, is talking about the brain, it's talking about the neurotransmitters also. I mean, this is my derivation. I'm sure people might not agree on this, but then this is what I think. I'd like to compare the neurotransmitters and the brain to the vital force. How are these neurotransmitters produced in the brain? There are different places. I already told you. So, there is something called as tryptophan, which is found in the turkeys. Before Thanksgiving, this is one of the statement that I have read. On Thanksgiving Day, turkey is eaten, and turkey's meat goes in and produces this particular thing called tryptophan, which causes the person to be happy and stuff like that. So it's there in a food. Now neurotransmitters are there in food, animal, mineral kingdoms, and all around us. Basically, God did not make us to fall sick. We were never meant to fall sick. We were made self-sufficient by God. It's just that we need to find out how do we keep all those hormones and dopamines and everything in control. What is the source of this instrument? Now, according to me, that's the beauty of homeopathy case taking. When you start taking a case, you not only take the physical aspect of the case, you start the emotional aspect of the case, the mental aspect of the case, the history. You're going back. Now coming back to what I told you about the subconsciousness, which is collecting all the information from the childhood. As you're taking the case, you go back and then you try to get out all the information. You come to a particular drug. Now, I am connecting this particular drug. Suppose it is Naxwamika. I am saying Naxwamika has got, it works on a molecular level or an energy level. It goes into the brain, it produces a particular chemical, a particular hormone, which sets right the brain and the vital force. So indirectly, what we are doing it, by giving homeopathic medicines, it's a shortcut to cure the deficiency of the neurotransmitter. So what is our totality? The totality of the symptoms are reflecting our moods, our emotions, our past history. They are indirectly reflecting the deficiency of a particular hormone in the neurotransmitter. So our drug goes in, fills that vacuum and restores complete health. That's a theory where homeopathy and the brain, they work together. Now that you know about the subconsciousness, you know how subconsciousness stores information, you know how the body listens to the subconsciousness, you know how powerful you are as a doctor, how powerful your statements as a doctor is. Having known this, now I want to come down to the basic thing of case taking. There are different types of case taking. When a patient comes to you, when we take the case, it's very important that you're focused on the patient. There are a lot of doctors who are distracted while taking the case. They're either looking at their phone, they look at the computer, they look at somewhere else and they take the case. They are not maintaining contact with the patient. It's extremely important to maintain contact with the patient for the simple reason that the patient needs to believe that you have understood his problem completely. I mean, I can give him many examples. I know of a doctor who just sits. He doesn't even look up. He looks down. Yes, what's your problem? Okay, take these medicines, you're going to be fine. There are a lot of doctors like that, but you are doing a commercial prescription here. There's something called as a commercial prescription, a non-commercial prescription. What you're doing, listening to the patient, writing a thing and giving off is a commercial transaction. I always told people that when they say the doctors are great, doctors are that, doctors are this, I said, no, they take money, so why are they great? It's a commercial transaction. But I realized that it is a non-commercial transaction when you do that extra bit. Now what you're doing here, writing a prescription and giving, is a total commercial transaction. They won't last long. They will have few trickling patients, but they won't last long. You need to connect with the patient completely. You need to listen to the patient completely as you're talking to the patient. If the patient cries, that means this patient has opened his or her subconsciousness to you. If she sheds a tear, she's ready to accept your suggestions. It means you're done. She will be stuck with you for the rest of your life unless you goof it up. Homeopathy case taking is so beautiful that most of the patients cry. I don't know, do you people agree with that? As you keep taking the case, all you ask is, are there any stress? Are you having any issues in the house? A normal doctor won't all those questions. If he comes for a sinusitis, why the hell you want to know about my family life? Why do you want to know why I am crying? But then that's a commercial transaction. But for us, our case taking has been taught to us so beautifully that we make the patient cry. The moment the patient cries and breaks down, that means the consciousness is gone, the subconscious is open. After that, whatever you say goes directly into the subconsciousness. How many of you have heard a lot of doctors saying that in the past, I don't know now, but in the past they used to say, there used to be a doctor, he used to see the patient, say, take this packet, go home, you'll get temperature, your fever will go off within a day, with the fever all your symptoms will go. Take this packet, go home, you'll have a loose motion, after that you'll be fine. It's not the packet that is causing the fever or the loose motions. It is the command that is being given to the subconsciousness. The body listens to the subconsciousness. You are God. That is why you are great. What you say is very important. So when the patient comes, at the end of it, you say, I think I can help you. Let's try. You try this. Let me know how you're feeling. It's gone into the subconsciousness, so the patient will doubt. Doctor says, you'll try. I may not get better. No. Now, let me tell you how I would handle a typical case. A typical case of sinusitis that comes, let's say. Now, we take the case and all that. All sinus patients don't cry, but there is a way to get across to them. Now, they come and tell us about the headache, the sneezing, nose block and all the, all the regular symptoms that they say. I tell them, look, let me explain to you what's the problem. So, number one is case taking. Number two is explaining to the patient what their problem is. Very, very important. Old school of doctors never used to do that, but they've started doing it now. You need to explain to the patient because they're all intelligent. They have all come after doing a lot of research. They probably know more than what you know about the disease. When you explain the disease to them, they connect with you. They know that, okay, this guy knows what is wrong with me. And then you need to explain to them, what are you going to do with them? What is your medicine going to do to them? How do I explain a sinus case? I tell them, look, these are cavities which are filled with air so that our head remains light. But because of your sneezing bouts, because of your allergy, there is a lot of phlegm which gets produced that gets accumulated in these cavities. And when it gets accumulated in the cavity, it causes nose block. It causes heaviness in the head. It will keep trickling into your throat. So you feel constantly to do, yes, that's what I do. Yeah. Then it goes into your lungs and then you start getting cough very frequently. You get throat infection. Yes, that's what happens to me. So now the patient knows that this guy understood what my problem is. Half your battle is won. Now you need to tell him, what are you going to do about it? I'm going to give you medication. These medicines are it's basically going to stop your sneezing bouts. It's stop your allergy. Once your sneezing stops, your phlegm production will stop. Once your phlegm production causes, the accumulation will come down. The phlegm will get absorbed by the medication. You will not have further production. Your headache will come down, your sneezings, your nose block, your cough, everything will come down over a period of time. Just stick with me for some time, I will take care of you. So I always say this particular statement to my patients, I will take care of you. What I am saying goes into the subconscious mind. Let me also give you a small history how it started. When I was in my 10th or 11th class, my dad took me to an ophthalmologist. Probably one of the few times I remember going to a doctor. I'm sure I didn't have specs, I didn't have sight, but I wanted a specs as all of us wanted that age, So this guy, he looked at me and then he said, Manoj, look, I'll help you. This is what you need to do. That particular statement, I will help you, remained in my brain till today. That's exactly what I use with my patient also. Now, what is the patient coming to you for? He is coming to you for help. And when you are giving a statement that I will help you, it remains in the subconsciousness. Patient believes that you will help him with the medication. Now, once he goes out of your room, convinced that you know the problem, you've diagnosed the problem, you've given the medicines, and you've also told him how it will help. He goes home, takes the medicines, he starts imagining how it is going to help him. Like I said, the subconsciousness listens to the body. So whatever you have given a statement in the subconsciousness, the body starts to listen, the body starts to respond. Now you will ask me, why should we give medicines at all? Why can't we just give them suggestions and send them off? Why medicines? But like I said before, what is going to take care of the neurotransmitters? What is going to take care of the vital force that is deranged? My suggestions are definitely going to help, but what is going to correct the vital force, the deranged vital force, is this selected medicine that is going to go and select. Another patient who comes for some other issues when they come, for instance, a pain in the neck, for a cervical spondylosis patient. You see the X-ray, you see the reports, you say that, look, this is a problem. What is a commercial transaction? You see it, okay, you got a C4, C5 problem. I'll write a prescription for you, do some physiotherapy, you're going to be fine. You send him off. That's a commercial transaction. Where are we different in this transaction? Now, apart from knowing that he's got a pain in the neck, when he comes to me, let me tell you how I handle the patient. I'll tell them, look, you got spine, you got a nerve which comes out of it, it gets compressed and it causes pain radiating to the hands. It can cause giddiness also. But I also tell them that a neck pain is not only a physical symptom. A neck pain can be an emotional symptom. How? I tell them, have you heard of the term called as a pain in the neck? That guy is a pain in my neck. This problem has become a pain in my neck. Why is that statement there? It's because when you face a problem, when you face a issue, the muscles in your neck, they go into spasm. I'm telling you what I'm telling my patients, okay? The neck muscles go into spasm. As the neck muscles go into spasm, it draws the spine closer. Once the spine comes closer, it pushes the nerves and the blood vessels and gives you problem. So what do you need to do? You need to relax your muscles. The medicines that I'm going to give it to you, they're going to relax your muscles in the neck. Once the muscles gets relaxed, it will release the pressure. Once the pressure is released, you will start to feel better. I have no business to tell this to the patient. There is no need for me to tell to the patient. I am wasting another 5 to 10 minutes of my time. But I am having access to his subconsciousness. Why are you tensed? I've got a lot of issues in the house, doctor. I've got a son who is not listening to me. I've got a daughter who wants to get married somewhere. So you get involved in that conversation. You start giving them advice. You tell them that it's okay. This happens. It's there in every family. So you are spending an extra minute with them. This is a non-commercial transaction. You're doing that extra bit for the patient and the patient will connect with you. Once the patient connects with you, you have access to the subconscious mind. Whatever you say will definitely come true. This is how you succeed in such kind of a patients. When a child comes with the parents, let's say a 2-year-old comes, we get a lot of cases in our clinics. Cold cough, recurrent cold cough. We get a lot of kids who come. Typically, what would you do? You examine the child and the child is non-existent for you. After that, you're talking to the parents. Because a 2-year kid has no business. So you talk to the parents, okay? So your kid has got a recurrent cold and cough. So what I'm going to do is I'm going to give him something to improve his immunity. He's going to feel better. So you take the medicines and go. This is what most of us do. But the mistake that we do here is we are not realizing that the patient who has come to us for help is the child. What do I do in my clinic? After examining the case, I call him, I ask him his name, I ask him his age, I ask him what he's studying. And then I'm going to tell him, look dude, you got a pain in the throat, I'm going to give you a medication. You're going to get up feeling much better tomorrow. I am directly talking to the kid. I've already told you the kid's subconsciousness is always open. You don't have to make an effort to open his kid's subconsciousness. It's already open. Look at the kid in the eye. Connect with the kid. Give him a high five. Tell him, you're going to be fine tomorrow. Trust me, the kid gets better. The kid will ask for you the next time he falls sick. I want to go to Dr. So-and-so. I don't want to go to this doctor. Because the kid has connected with you. The kid has connected with you. The subconsciousness of the kid has connected with you. So speak to the kid. Very important to speak to the kid and not the parents. You need to tell the parents, they are worried naturally. But you also have to talk to the kids. Now you will ask me, how are you saying that, what you're saying is what the body is listening, and how is it that, what is the proof that your commands are being listened to and all that. One small example which I forgot to give you was, in the allopathic trials, suppose a medicine for BP or BP, let's say BP medicine is there. How is the trial conducted? They give them BP medicines to 100 people, they give placebo to 100 people, correct? Isn't that how it is working? People who are having BP medication, let's say 45% of them get better. People who are having placebo, 35% of them also get better. This is documented evidence. Why do they get better? Because they believe that they are taking medicines for BP. Their subconsciousness believes they are taking medicines for BP, and the body reacts to the placebo. So it's not simply, it's a documented evidence that placebo has its effect. So this is how important what we talk to the patient is. Not just giving medication. You do not treat a patient by having knowledge of the book. You can gain whatever amount of knowledge you want, but they don't get better unless you connect with the patient. It's very important to connect with the patient on a particular level. Now, we also ask ourselves a lot of times in our homeopathy case taking, we take the case for a good 30 minutes, 40 minutes, 50 minutes. We do repertorization, we do computer repertorization and everything. We come across to a well-selected remedy. We are very proud of it. And we are very sure it will work. We give it to the patient. Patient comes back in a month saying, no change. It happens many a times. And we blame ourselves. No, our selected medicine is wrong. But that's not true. I don't think your selected medicine can be wrong because you have learned 5.5 years of medicine. You've got so much of experiences. It is not the medicine that is not working. It is the connect that is not there. You need to connect. You need to tell the patient that these medicines will work. You need to stimulate the healing power of the patient. That is what we doctors do. By talking to them, by giving them medications, we are stimulating their own power to heal. They heal themselves, but they need somebody to stimulate that healing power. So that is how important our statements are. We have a lot of youngsters sitting here who are probably practicing or going to practice or doing post-graduation. A piece of advice. Unfortunately, the younger generation I've seen, the moment they come out of the college, brilliant students, they do the graduation, they do the post-graduation, they slog. It's not easy to study medicine. They really slog it out. And they get gold medal, they get very good marks, they come out. And they're very confident when they come out. The moment they come out, they listen to various methods of practice. One is talking about embryo, one is talking about miasm, one is talking about predictive, one is talking about multiple, one is talking about this one, that one. What is right, what is wrong? Let's learn everything. So for the first 3 months you go here and learn, for the next 3 months you go there, you learn everything, you have a lot of knowledge, but you're confused. What does a confused mind do? You're not confident. You're confused, you're just not confident about yourself. So when a patient comes to you, you don't know which way to treat. You're like, okay, you take this medicine, you come back in a week's time. In that week, you call up this guy. This is the patient who came, what should I give? You call up that guy, this is the patient, you call up this guy. You're confused. You're not doing any justice to the 7 years, 8 years of medicine that you've learned. You're not doing any justice. You're not being yourself. You're trying to be somebody else. How much will you learn? Isn't 7 years enough to become a doctor to study and practice? Do you have to go on studying all your life and still be lost when somebody asks you something? No. 7 years of slogging in the college, that's enough, guys. You've done a lot of studying. That's enough for you to treat a patient. Now let me talk about myself. Venu said so many things about me, okay? I passed out in 1990. My dad was a homeopathic doctor. I sat with him for about a year. I've seen how people practice. I've been to Dr. Janardhan Reddy Garu. I've been to a lot of people. I've seen how everybody practices. I have no idea about embryology. I have no idea about predictive homeopathy. I have no idea about Mayasm. I have no idea. In my college also, I don't know how I passed. I don't know. All my knowledge is what I've learned in the college and what my patients have taught me, and Google. So I don't know any of these complicated methods of practicing, but they call me successful because I am seeing results. So don't get confused. Don't go and you learn it. I mean, you go learn these things, and probably you can adopt. Different types of patients comes. You adopt different types of prescriptions. For this particular case, this works well. Stick to that. This particular case, this works well. Stick to that. So be confident when you are out of it. The confidence. What is the most important? In my whole talk today, what I am trying to tell you is two things. Number one, you are a very powerful person. The statements that you are giving to your patients go into the subconscious. It's like God speaking to them. It's a command. You cannot make a command unless you are confident. And a person who is not confident, you take these medicines and come back to me in a week's time. But a person who is confident, go take these medicines, you're going to be fine tomorrow. It's the tone with which you tell the patient that you're going to be fine. I am recollecting a colleague of mine who has come from a very rural background. In college, guy had no idea about English. He only used to speak Telugu. The lecturers used to tell us, go, please help him out because he's not understanding what we are talking in English. We used to help him out. We have no idea how that guy passed. We wondered how he will be doing. Today, that guy is one of the most successful practitioner in AP Telangana. Most successful. How? His confidence. He has treated AIDS. He has treated cancers. I never believed that he could, but today I believe that he can. Because he has that confidence in him to stimulate the power of healing in a person. He can give that confidence to that patient, that the patient heals himself. It's not about knowledge, ladies and gentlemen. It's about your confidence. You need to be confident and your patient will definitely get well. So, I didn't want to talk too long. This is as much as what I want to talk. We have students, we have a lot of senior doctors, we have my colleagues here. I am ready to take on your questions and answers. But I have already told you I have no idea about embryology, I have no idea about all this. So no technical questions, you can ask me questions about experience. You guys have just passed out, you read the books now, don't ask me technical things. I am ready to answer things which I can answer as an experienced physician. But before that, one small request to the senior doctors who are sitting here, my colleagues who are sitting here, who have been practicing for a while. If you think that what I have told is true, if you think that it's about the confidence, it's about the command that you give to the patient that works. I'm not saying the medicine doesn't work. I'd like you to come up and say a few words for the sake of the youngsters so that they go out feeling confident. They go out feeling sure that whatever knowledge they've got is enough for them to become successful. I request my senior colleagues to come and say a few words. After that, I'm ready to take up the question and answers. Thank you so much. Okay. So basically, we get a lot of patients of psoriasis. A lot of them. I mean, every day we see a lot of patients who are coming with us for psoriasis. Now, like before that, Dr. Shivshankar said, as we are getting busy, we are not having much time to spend with the patients. If you look at my practice on an average, if I time my practice, I spend only about 3 minutes per patient. But in that 3 minutes, I connect with the patients. I don't give too much of importance to the prescription. I give a lot of importance in connecting with the patient. I explain to them what I'm going to do with them in that 3 minutes. Now, psoriasis patient comes, once the case is taken, the junior doctor takes the case, they come to me. I tried explaining to them. I asked them, have you read about psoriasis? They said, most of them say, yeah, we know. So you know it's something to do with the mind. It's an autoimmune disorder. It's something to do with the mind. And then I tell them, I give them an option. I tell them, what is your option in allopathy? The allopathic option is either you start on steroid ointment, you start on methotrexate, you start on a steroid or a biological. These medicines will only control the disease, they will not cure the disease. But then these medicines are capable of destroying your liver, these are capable of destroying your kidneys. So that's the first option I give it to them. Then I tell them, what can I do for them? Once you start on homeopathic medications, it is going to take time. But over a period of time, your lesions will get better. You will not develop complications. And one of my clinching factors, this is one tip that I do in my practice. If you notice, the next time a psoriasis patient comes to you, ask them straight away, are you Jan or October born? Trust me, 99% of the people are Jan or October born. In and around Jan and October born. I think, I don't know, it's got something to do with the stars. So, once I ask them, and most of them they say, yeah, I am Jan born. The patient is all yours. Or if they say, I am October born, patient is, he thinks that you are a magician. You don't know how to deal with it. You try it out in your case sheet. Most of them are Jan or October. December, Jan, October, November, they will be that. So that's one of the way I deal with them. I tell them to use virgin coconut oil externally, not use any ointments. I give them medications and most of them improve. Most of them. It does take time, but most of them improve. I don't give too much of importance to mental symptoms and all that in this, no. It's basically what I'm trying to tell them. I'm just triggering their healing power for them to feel better.